So late onset, the challenge of late onset is really determining the presence of Alzheimer's disease and excluding comorbidities. But we know that the majority of Alzheimer's disease patients, when they die in their 80s and 90s, maybe 75%, if not more, would have additional pathology present. It would not be just amyloid and tau suggesting Alzheimer's disease. The challenge with the early onset cases is how different they present from the late onset. About half of them would present with memory impairment, but the other half have memory sparing presentation, where they could have predominant visuospatial impairments, a condition known as posterior cortical atrophy, or a language predominant variant, as in logopenic aphasia, or a frontal variant, which actually resembles quite closely frontotemporal dementia. It's a challenge to recognize that these early onset subjects have Alzheimer's disease because although we don't have great treatments, we still have 2 approved classes of medications on the market. And for people that are still in the workforce and that are raising children, it's very important that they get on all the therapy that's available out there. It's also a cohort of patients that have not gotten exposed to the opportunity to participate in clinical trials as much, but they do not have, they have a pure form of Alzheimer's, they do not have other comorbidities, and they have an aggressive course. So they're an ideal clinical trial cohort if you think about it.